We'd love to know where you are joining us from. So maybe drop in the chat. Where are you zooming in from? I am zooming in from Atlanta, Georgia, where the weather is incredibly confusing. I have sweaters on in the morning and then I'm in t-shirts by the afternoon. Let's see, where are people coming in from? Watertown, New York. Where is Watertown, Jennifer? That sounds like a really interesting place. Where's that? Feel free to come off mute. Are leaving in the, oh, way up north by Canada. Okay, cool. Rockland County, New York. Okay, New York is in the house. Hello, New York. Hello, Texas and Colorado. So excited. Ooh, Hawaii. Aloha. Thanks for joining us, Brittany, in Hawaii. Cool beans. Belmont, Edison. So excited to have people from all over. We are going to get started with this exciting topic. Peers and Clinicians Together are our PACT series, where we, as the name says, have a peer support specialist join in and a clinician, having conversations together, but also having conversations with you. This is meant to be an interactive session, so we hope that you're ready with questions. Feel free to drop them in the chat throughout the session, and we'll get to them. So today's session, we're focusing on cannabis and mental health. Before we get started, I want to make sure everyone knows that at NTTAC, we are under a cooperative agreement with SAMHSA, or the Substance Abuse and Mental Health Services Administration. And our wonderful, awesome guest speakers today are sharing points from their own perspective and not a perspective of SAMHSA or our center. Also, please note that we are recording this session today. So if you like reruns and you like to watch things over and over, you can come and binge watch NTTAC sessions, and this will be a part of it. So we encourage you to come back and watch these sessions. We'll share them with you via email. They will also be posted on our website. Okay, for session security, if you have wood around you, let's knock on it real quick. If there are any issues that occur during the session, we will immediately end and we will share with you all a separate link to rejoin. But like I said, hopefully, knock on wood, that will not be happening today. I want to give a special shout out to all of our different partners that are here on the screen for helping us do the work that we do. We provide services across the board, from podcasts and resources, trainings like these, and trainings on different topics around children, youth, and family mental health. So shout out to our partners and shout out to you all for being here with us today. For a couple of frequently or commonly asked questions, I wanted to go over those. We do provide a certificate of completion for this event. So if that's something that you need and you've joined through phone, you can email Joanne Bloom or jbloom@cars-rp.org. We will, like I said earlier, have a recording of this session that's made available, so you can keep an eye out for that or visit our website. So with that being said, I am going to pass it over to our awesome and incredible guest speakers today, Matt Beal and Ariana Mellinger, who will introduce themselves and start the conversation.
Cool. My name's Ariana Mellinger. I started working as a youth peer support specialist. What that looks like is having lived experience in having a mental health diagnosis, struggling with substance use disorder, and also having justice involvement in my time as well. I started about 3 years ago, and I'm also a recovery peer support specialist now.
Thanks, Ariana. It's awesome to have a chance to do this with you today. I'm excited to meet you and to have this conversation. My name is Matt Beal. and I'm a child and adolescent and family psychiatrist. I'm in Washington, D.C., and I'm the chief of the Division of Child Psychiatry at Georgetown University Medical Center. And I'm a clinician. I work with children and adolescents, young adults and their families in the DC area. And I also have the opportunity to work in schools and in primary care settings and to do research and run programs across the DC area. And really excited to have a chance to collaborate with Ariana today and also to include you all in our conversation. Ariana and I decided as we were planning for this topic that this is such an interesting and engaging and relevant topic that we're not gonna do a sort of a boring kind of presentation of slide after slide. And here's the fact, we're gonna have a real conversation about real things and what we're seeing in our work with young people and their families. And then we're really interested to hear from you all too about your perspectives. The topic is cannabis and mental health. And this is such a relevant topic because it's a factor in so many young people's lives. I think Ariana and I agree. The legal landscape for cannabis in the United States continues to change. My last check, cannabis was decriminalized in 31 states and legal for recreational use in I think 23 states. Of course, where it's legal or decriminalized, that's for people 18 and over. And yet because of the changing legal status, it has really the use of cannabis and the way people think about cannabis in our lives has changed a lot. I think even the last decade or so. So Ariana and I, we're gonna have a discussion back and forth, and I hope this is engaging, and we're gonna be monitoring the chat for questions that you all have as we go. Ariana, let's just start by sort of laying out some observations that we have. In your experience working with young people, how common is cannabis use among the young people that you work with?
Cannabis use is super common amongst everybody. Like you said, Matt, it's very almost like a blasé topic sometimes. People are just kind of accepting more days now that people use cannabis. And there's many of people, I live inside Houston, Texas, and so it's not decriminalized yet over here. It's not legal either, but still in such a conservative state, there's a lot of people that are still very open about it and very okay with it. In my experience, youth tend to use cannabis in different ways as well. So Matt, would you tell me what kind of ways are you seeing different people use cannabis?
Yeah, thanks. I mean, my experience in DC, and I live in Maryland, just outside of DC, and it's decriminalized or recreationally legal in both places. And it's 420 today. It's not it's sort of a funny day to be having this talk. And I know walking down the street as I go, walk to the subway and head home and head out at lunch, from my office, I'll smell cannabis on the street. I mean, it feels like very, very present. And that means it's very present in young people's lives. And I agree, the young people that I work with have a sort of an acceptance that of course it's around and of course they're exposed to it. It's interesting. It's one of those topics that people's estimation of how common it is actually greater than what the statistics tell us is actually real. So I think if you'd ask the average 15 or 17-year-old, how many people your age smoke weed or use cannabis, they'd say everybody, or almost everybody that I know. But if you look at survey data where adolescents are completing these sort of national surveys, it's closer to like 25 or 30% of young people, high school age kids. So there's this discrepancy between people feel like on the one hand feel like, well, everybody's doing it, it's totally normal, it's not even really illegal. Yet on the other hand, there's a lot of young people who are choosing not to use cannabis, and I'm sort of curious about why that might be. In your experience with the young people that you talk to and that you work with, do they think about cannabis differently than other substances that they may be exposed to, or that we think about as substances that are intoxicants or substances of abuse?
So I can give a great example. So I worked with a young man who his father had died of alcoholism. And so he had a great example of like what alcohol can do to his life, but he didn't have an example of what marijuana did. So he was like, absolutely not. I'm never gonna drink. Versus the like I've never seen the effects of what happens, you know. So a lot of the times it's not being educated enough on what can happen to you if you use to extensive amounts. What does that progressive portion look like of it?
Yeah,
So you
I was just
you
gonna,
know,
I was just
go
gonna
ahead.
add to that. I think you're right. I think people think about it differently than alcohol. I think they think about it differently than pills like
Mhm.
benzodiazepines or opiates. They think about differently than certainly than drugs that they inject or intranasal drugs. It does seem to have a much different sort of valence for young people about how sort of relatively innocuous it seems.
I've also seen it where they're very like it's not a big deal to them to get behind a vehicle and use a vehicle after smoking. It's to because to them it's not even that bad. They're like, oh, I'm not drinking and driving. I'm not killing anybody. And I'm like, but you can be intoxicated. Like you're still not in reality. So I'd be curious as well, in the states that it is legal, where do you see that distinguishment? Kind of like alcohol, like if you have two drinks, like you're gonna go to jail, you
Hmm.
know? So
Hmm.
where do you see that distinguishment?
Yeah, it's a great question, and I'm not much of I'm not anything of an expert around law enforcement. I think that you're absolutely right that I think young people in particular have different attitudes about the risk of driving drunk versus driving high or stoned on cannabis. And you know the it's clear that when if you ingest cannabis, if you smoke weed or if you take edibles, your reaction time is slower, your physical coordination is poorer. So there's lots of evidence that it makes you a much more dangerous driver. And yet I don't know what happens much around enforcement of driving while intoxicated with cannabis. So it's a really good question. I suspect it's probably a really important public health factor, something I need to learn more about. When you mentioned your own lived experience, which I think is so important here. How do people that you work with, let's talk about sort of the most common mental health conditions in young people, like depression and anxiety. There's
Mhm.
lots of conversation in the media and topics coming out in research demonstrating that depression and anxiety are really, really common in young people right now. We're living through a true epidemic of depression, anxiety, and loneliness in adolescents and young adults. How do young people that you work with who may struggle with depression and anxiety think about cannabis and its relationship to those conditions?
A lot of the times they look at it as an escape. A lot of the times they're looking at it as something that helps deal with their anxiety, especially. That's one of the biggest ones. Well, man, I can relax. I can take a breath. And so it's hard to combat that whenever the education out there can support sometimes especially using it in depression, right? So especially people in Texas, well, they do it up north, you know, like, and I say, well, but it's not legal here yet. So let's look at different alternatives that are, so you don't get in trouble with it. And so using the lived experience of like, what can we explore? What are you willing to explore?
Mm.
Is a huge portion of connecting like the peer to the clinician, right? Like, so having those open conversations and saying like, well, what are you willing to speak to your psychiatrist about?
Mhm. Yeah, I mean, that's been my experience too. I think people find cannabis to be this, like, if you smoke a blunt or take an edible, there's an immediate impact on your sort of emotional mental state. You might feel relaxed, you might feel sleepy, you might feel giddy. And for kids who may be feeling lots of persistent sadness or fear or anxiety, particularly if they're not getting effective mental health treatment, I entirely understand the appeal of having
Mhm.
temporary relief. And so I think you and I are both taking this stance in this conversation of really not judging on people for their interests or their exploration here, but looking for opportunities to educate them about what's, sort of what's really going on here. And I think that, many people talk about cannabis as sort of an effective treatment for anxiety. And I think
Mhm.
it's important to point out that there's never been any studies that have been well designed, objective studies that have demonstrated that cannabis is an effective treatment for anxiety or depression. And
Right.
so, there's like tons of clinical evidence from people with clinical experience who know from our experience that particularly with heavy use of cannabis, that there's a really problematic effect on people who may already be depressed or anxious. And like
Right.
specifically, if you're a person who's like got a ton of anxiety and you're having panic attacks, or you have OCD symptoms, or you have generalized anxiety, and you smoke weed at night or in the afternoon to relieve your symptoms, there's something very reliable that happens, which is that there's this temporary relief in symptoms.
Mhm.
And then you wake up the next morning and your blood levels of THC are falling, and you have rebound anxiety. So you feel actually more anxious than you may have to
Mhm.
begin with. And
It
then
exacerbates it.
totally.
Exactly.
And so it creates this cycle of like, well, it's the only thing that helps me feel better, so I smoke, and then the next day I feel worse again, so I smoke again, and it leads to everyday use. And then you get this phenomenon in people who are depressed, who may smoke to sort of escape, as you said, from feelings of sadness or depression, where really regular cannabis use is a depressant.
That leads me into thinking, yes, regular cannabis use is a depressant, and whenever you look at more into it, it's linked to kind of the same withdrawals as alcohol is. If you look at it, except having to, like the potential loss of death and stuff, but the irritability, things like that, you experience those things when withdraw. So I'd be curious to know, what do people, in your experience, when working with them, what education do they know about cannabis use and mental health?
I mean, I think young people are like, we all know, they're really curious, but they're selectively curious. They tend to seek out information that may confirm what they want to find out, or may
Mhm.
confirm some of the biases that they share with their peers. And so I don't think that most young people know, unless they learn from their own experience, that smoking weed every day really saps your motivation. It really saps your energy. It makes you a much more boring person. I talk to young people about this all the time. Like, tell me about what your life was like before you were smoking weed every day. What did you used to do? And they'll tell me about hanging out with friends, or playing sports, or drawing, or sort of being out in nature and exploring. And then I say, well, tell me about your life since you started smoking weed every day. And
Mhm.
it's oftentimes the case that their life has gotten very, very narrow,
Mhm.
because they smoke, and then they sort of lose, in psychiatric terms we call it amotivation. They sort of lose any sort of impetus or desire to go out and do something new. So they'll sit around, they'll snack, they'll watch TV, they'll watch a movie, they'll be on their phone. And that's actually, like, I find that to be a very meaningful reflection back to
Right.
people who are using a lot, or smoking a lot of weed, is how boring their life sounds. And
Right.
how small.
Like, look at all these things you used to do. What if we try implementing one again
Mhm.
and start to try and reduce the amount of times you're smoking to see if that might add meaning back into your life?
Right, exactly. And I think that's a hard thing to appreciate when you're the young person going through it, because it happens slowly.
Mhm.
It's sort of a little by little, you're sort of seeding activities that you used to do in favor of just sort of like hanging out and smoking. And so it's
Right.
like it's a hard thing to appreciate, but I think it can be a helpful thing to reflect back. I don't know, how much you think kids are aware of this other sort of fact, which is that, like, the product itself has changed so much, particularly since legalization. The potency of cannabis that people get either from dispensaries or from buying it just on the street, it's up to 1,000 times more potent than cannabis was 20 years ago.
So
And
yeah, nobody knows that information. And whenever you're presenting that to them, knowing that, hey, look, like there's way more chemicals in it now. There's not as it like years ago, it was being processed different, right? Like they, like you said, in the dispensaries, you know, there's different things that happen to them, especially whenever you're creating them in gummies, you're mixing them with other things. And so it's just opening that education door to them, saying like, let's look at how many other chemicals you're also putting in your body. These are the types that are already known to be able to be mixed with them. In your experience, when you're seeing other chemicals mixed in with it, especially the potency, what does that look like to you as far as tolerance and how hard it is to withdraw off of it?
yeah, I think it's changed the substance a lot. The fact that I mean, because it's become this enormous multi-billion-dollar industry, there's so much research and effort going into making sort of more and more refined products that are getting to kids and that are, as I said before, so much more potent. And cannabis, without sort of geeking out too much on the science here, cannabis is this like very interesting substance that people put into their bodies because our brains actually have receptors for cannabis, for the molecules that are in cannabis, and they're all across our brain, and they're all across our sort of different systems in the brain that affect mood and behavior and sleep and alertness. And there are natural chemicals that the brain secretes that activate those receptors. And when people ingest cannabis or smoke it, particularly when it's really, really potent, it hits those receptors in these very powerful ways that are much stronger than the brain is used to. And so that explains why people get high. But when you start to introduce these really, really, really potent strains of cannabis, it really changes the reaction in a way this is not your dad's weed.
Right.
This is not cannabis as it used to be that caused sort of mild short-term highs. The highs are super intense. The highs can often induce really intense psychiatric symptoms. So it's really common these days to hear about people having intense panic attacks when they use cannabis, to having symptoms of mania, to having symptoms of psychosis, to hearing voices, or to having delusional thoughts, to getting aggressive, to getting profoundly sedated. Like, so depending on the different formulations that people ingest or that they smoke or vape, they're very, very powerful effects in the brain.
Right. And so what I've seen common is people not knowing that it could potentially lead to mimicking or creating a psychiatric disorder, and then it's sticking with them the rest of their lives if they're, if it's in that genetic trait of theirs. By the research that I've heard, and this is just from education, is that if you have the genetic trait for schizophrenia, then it can pull it forward. Yeah, and just by simply educating a youth in that alone, at first they don't believe you. They're like, yeah, right. And then you come back with the research and they're like, oh, whoa. And then they go and tell their friends like, hey, we might need to reconsider this because, like you're saying, the potency is different and they're seeing it within themselves.
Yeah.
I've been clean for 5 years, and people who used to smoke marijuana now are seeing other people smoke marijuana and they go, what in the world? And that's just only in 5 years. It's changing rapidly.
Yeah, I'm so glad you mentioned that, because I think that it's one of the things, if we could get one piece of information out to young people that I think is the most important and valuable, it's that using cannabis heavily can actually cause mental illness, not just exacerbate mental health symptoms that people are already saying. So yeah, I see the question in the chat. So yes, people who are ingesting high potency marijuana can experience manic symptoms, panic symptoms, psychotic symptoms. And if you ask young people that, you'll hear about these symptoms happening frequently. the drug has gotten so powerful, but it's not just having, it doesn't just cause a few hours of manic symptoms or psychosis. It can actually cause the precipitation of long-term severe mental illness.
Right. Early onset programs were created just for that simple fact, is you're starting to see psychosis happen for youth at a very higher rate.
That's right. That's
And
right. And it seems to be the factor. Like we're seeing many more young people develop early symptoms of schizophrenia in their teenage years than was happening before. And a common factor seems to be regular heavy use of cannabis. It's this sort of factor that's changed in public health, and we're seeing the impact on increasing rates of schizophrenia in young people. And yes, this includes vaping. So this includes cannabis ingestion by any means, by vaping, by smoking, by edibles. And I'm not talking about one or two uses, but when young people are using heavy and regular doses of cannabis by any means, it significantly increases the risk of psychosis. It significantly increases the risk of developing schizophrenia. And as everybody on this call knows, schizophrenia is not something that comes and goes. Schizophrenia for most people is a lifelong illness.
right.
And not everyone, you mentioned this, Ariana, like not everyone is at the same risk of schizophrenia. Schizophrenia is a genetically coded condition.
Mhm.
Not everyone who has the genes develops schizophrenia. But if you have the genes for schizophrenia, if there's schizophrenia in your family, and you're someone who uses cannabis heavily, you're significantly elevating your risk of inducing schizophrenia or another psychotic condition in yourself.
Right, because I mean, so a lot of the times what I was saying earlier in years, it was 18, 19, whenever you're first experiencing high stress, and now it's becoming much lower because of that high cannabis use, if you're predisposed to it.
That's right. I mean, I think all of us, no matter where we live, are seeing in like these rapid increases in homelessness among young people. And there's a high association of homelessness with early onset psychosis and schizophrenia. And people are starting to make observations, and there are studies about this, and people are writing about the potential connection between lots of heavy use of high potency cannabis in adolescence and early onset psychosis, persistent psychosis, development of schizophrenia, and some of the increases in homelessness that we're seeing in so many cities. So this is not like a trivial effect. This is a really important effect. Sorry to interrupt.
And I saw somebody say like induce, like, so there are some drugs that can induce certain things, but the things I have witnessed and seen, it stays with the person.
Totally.
And so it's very different than the induced portion of, like, say methamphetamines. Whenever you're using methamphetamines for a long time and then you have induced psychosis, like, there is a potential for that person to be able to remove that psychosis in methamphetamine usage. Some, it does stick with them, but others, there's more of a potential. And I've seen with cannabis use disorder, I've not seen yet somebody that's had the onset that their symptoms have gone away.
Yeah, that's an interesting question and an interesting observation. I think that's something that folks are researching right now, is that, how reversible is this, and how much does stopping use contribute to the reversibility? It's like thinking about it in practice when I'm talking to young people. One of the things that you hear most from young people, including from my own kids, is that's not fair. They hear about an observation or recommendation, and they say that's not fair. And this is, so if I'm talking to a 15 or 16-year-old, and I know that they've started to really use cannabis regularly, and I'm worried about it, and I start to bring up this topic, and oftentimes what they'll say is, well, my friends use, and my friends all smoke all the time. How come they can smoke and I can't smoke? That's not fair. And I'll say to them, look, you're right, it's not fair, but your mom has schizophrenia, or your dad and your brother both have bipolar disorder. So we know that genetically, you and some of your friends probably have different risk. And
I mean, the same thing in alcohol use disorder. You have that genetic trait inside of families that you can see clear as day in genograms now, right?
Totally.
That you can trace it back. And so therefore, when you know your risks, at least you're more educated in order to make a better informed choice. For years, my family used to be like, oh my gosh, you're at this high risk, your mom, your dad, they all have substance use disorders. And until I really got with the fact that what that looks like for me, yeah, you're going to say, well, that's not fair. You're still going to try it, but at least you're informed of saying, like, when I'm ready to quit. And you have to be ready for sure. When I'm ready to quit, then I know, like, I'm able to not have that risk anymore.
Yeah, I think that's I love that observation. Thank you for sharing that, and appreciate your sharing your personal angle on it as well. I think it's really important and powerful, and I think it's a opportunity to be empathetic with young people and to say, you know, like, you didn't ask to be from this family. This is, you know, this is who you come from, and there's things about it that you don't like, or that, you know, that suck, and there's things about it that are great. And, you know, for you, knowing what we know about your family and about your mental health, for you to accomplish the goals that you told me you want to accomplish, you want to do this, you want to go to this school, you want to have this career, you want to have this kind of life with your family. I don't think that you can do those things and be somebody who smokes a lot of weed.
And that's a huge impactful thing, especially to come from a peer, you know, from somebody like, you're 100% right. Like, when in active addiction, I could never accomplish the things that I've accomplished today. And to be able to encourage others to accomplish those things is amazing. To sit there and see them, like, the light bulb click off and go, oh, I do have goals. I do have these desires. Like, you're not lost to being kind of just floating around in life.
Totally. I think it's so powerful. It's so your clients are lucky to have those conversations with you. So you're reminding me of another question that we talked about, which is, how do you handle situations in which there may be a young person that you're working with who you feel like their cannabis use probably isn't helping them, and maybe getting in the way of them achieving their goals, and yet their family may not be on the same page as you. In fact, their family may be full of people who smoke themselves.
Right.
They may live in a house where their parents are smoking weed every day. How do you take that on from a family perspective? What techniques do you use?
So from a family perspective, first you have the family involved, especially whenever it comes to recovery at any point, and see what they're willing to do. Some of them might tell you absolutely no, like, this works for me, it's my kid who needs to be fixed, and it's not me. So then if you go to the family and you say, like, hey, let's create these things to support their recovery, and they're not willing, then you create coping skills within the child themselves of how to remove yourself from it whenever it happens. How do you be able to do more grounding stuff, you know, of reaching out, going to meetings, taking time, things like that. Because I mean, it's, especially in legal states, if you struggle with it and you're willing to work on it, it's going to be on the corner.
Right.
It's going to be in everyday life. And
Absolutely.
so you teach them how to deal with everyday life on life's terms just by removing the substance. Absolutely.
It makes me think about some really powerful techniques that people use to help people quit smoking cigarettes.
Mm-hmm.
And what I've heard people do, which I think is really, really effective, is really ask people who are addicted to smoking cigarettes to really pay very close attention to everything that happens around smoking, to the taste of the cigarette, to their breath while they're smoking and after they smoke, to the smell of their clothes after they smoke, to what happens with their mood when they're craving a cigarette and then after they smoke. And just by, like, drawing really, really close attention to all of the things around smoking that people tend not to pay attention to, it can really prompt some curiosity around change from, like, a motivational interviewing perspective. And I think the same applies to people who are surrounded by people who smoke, like, smoke weed. Like ask them, like, well, what do you say your mom smokes weed all the time? Well, what's she like when she smokes weed? Like, what's it like to be with her after she smokes?
Right.
Do you like being with her more when she's high or when she's not high?
And sometimes some of the youth I've seen recognize within their family that, oh, hey, my mom or my dad is angry if they do not have this. Like, I prefer them to be intoxicated than to deal with them without it. And so sometimes looking at it from that lens too, of like, well, let's figure out how we can deal with your emotions as far as what that looks like to their reactions, because you can't control other people's reactions, but how you respond to them is the only way.
Right.
I have lots of questions and conversations happening in the chat. So I just wanted to, if we could uplift some of those questions. So we do have a question here about if the disclosures comments that might be encouraging the cannabis use take place in a group setting, while the topic is not on cannabis use, how do you handle the discussion gently and effectively without causing a shutoff or a perception of being judged? The goal is to keep them in conversation and to have them have an open ear. What will you emphasize in 1 minute you have to make such an inviting remark?
So just so I understand the question, the question is if there's a group setting happening, like a peer support group, and someone makes a comment that seems to be minimizing the importance of cannabis use or making it seem appealing or normal, is that the question? Okay, I see a nodding head. Yeah, I think that's, I think like in general, the right stance to have if we're in a clinical or supportive role with young people on substance use is just curiosity. So, if that comes up, I think that probably the best ways to respond are, tell me more about that. And what do you notice about that? And do you ever think about things from the other direction? And might there be any downsides? Or do you know any people who have struggled with that? And what advice would you give to your little brother or your little sister about that? Just a non-judgmental curiosity about where that's coming from, I think sometimes can be helpful. Ariana, what would you say?
I think going from the curiosity standpoint always works best, because, if you're mentioning something, there's a reason why you're mentioning it. I feel like, especially in a group setting, right? So therefore, you already kind of want to explore that. So helping that individual explore that a little bit deeper, it's like, okay, well, what are your thoughts on how it affects your family, on how it affects, what are those things that, even though it might be, as you say, like, okay, what makes it okay for you? Exploring deeper into those beliefs and those values.
There's another question here. If we don't have the reliable use info through patient intake, are there any distinguishing clinical differences between cannabis-induced schizophrenia versus naturally coming out schizophrenia, or cannabis-used psychotic attack versus other forms, for example, postpartum psychosis included psychotic attack?
No, from a clinical standpoint, there's really no difference. There aren't clinical characteristics that differentiate. The symptom profile is really the same. And in fact, in my experience, when I'm taking call or doing work in patient settings, and I'm seeing patients with psychosis, it's very rare these days where cannabis isn't part of the picture. Doesn't mean that in all those cases it's the cause. Like, the causes are complicated. There are all kinds of complicated causes of psychosis for people who are vulnerable, but it is oftentimes part of the picture.
I don't have much to say on that, just because I don't have any clinical experience in that.
Gotcha. There's a question here. How about smoking marijuana while taking other medications, such as Latuda? How does this affect behaviors, mental health?
Yeah, that's a great question. There's a couple ways to think about it. One is that, for all the reasons we just talked about, people who have a psychiatric condition, who have schizophrenia or bipolar disorder or severe depression, who are also smoking weed, are probably not getting the benefit of their treatment. It's probably taking away from the effective medications that they're taking. There's the interaction between, like, the sort of chemical interaction between cannabis and medications is very complex, and sort of, it's hard to say much about that, because cannabis is such a complicated molecule in the body. But I think that it's safe to say that oftentimes that's an indication that people are not going to be getting the benefit of their medications. It's also, as a psychiatrist, if someone that I'm treating for one of those conditions is also smoking weed, that's feedback to me that their treatment isn't helpful enough. That we need to be doing something different on their treatment, because they're still probably self-medicating with cannabis as a way to cope with symptoms that they're still finding really hard to tolerate. Ariana, what's your perspective there?
I agree. It just tells you something isn't working in the treatment, and to be able to do harm reduction from it and see what symptoms is causing them to be able to still want to use. Is it their depressive symptoms? Is it for fun? Like, what is causing your usage? And let's dig a little bit deeper.
Right, absolutely.
Okay, I think this is one of the last questions I see in the chat. Do these same points apply to products that are primarily CBD as well, or is this specific to the psychoactive properties and THC?
Yeah, that's a really good question. So it's really most connected to THC. So the effects of THC are the ones that seem to be tied to these acute symptoms of anxiety, panic, delusions, hallucinations, and that also seem to have to increase the risk for longer term persistent mental health problems. CBD, which is much less or minimally psychoactive, does not seem to have that same risk profile. Again, this is sort of new science. There is some small amount of evidence from studies actually in other countries that CBD can be helpful with specific things like sleep and anxiety. Those are not sort of big or replicated studies, but they're interesting, and there's a lot of research going into that. I don't recommend CBD to my patients at this point. I don't think there's enough evidence for that, but I do help patients understand that difference. That CBD seems to have a much lower risk profile than THC. I hope that addresses the question.
There's another one here. Oops, I'm sorry, Ariana. Yeah.
It's okay. I actually want to expand onto that one. I'd be curious to know the difference between the CBD and the Delta 8, because Delta 8 has a property of THC, right?
Delta 8 is a mess. I mean, we don't really understand what Delta 8 does.
Right.
It can cause, a few years ago, spice and K2 were really common, and now more recently, Delta 8 is the synthetic compound that's more common. And people show up with all kinds of psychiatric symptoms and sort of destabilization after using Delta 8. It's really not well characterized how it affects the brain. It's something I really try to encourage people to rethink.
Thank you.
Yeah.
Another question just rolled in. Does the use of cannabis affect the brain in a traumatic way, such as chemical-induced traumatic brain injury?
That's a really interesting question. I don't think about it specifically as a trauma, like a TBI involves sort of an injury to the brain, actually to sort of the tissue of the brain, to the cells and the makeup of the brain. I think of cannabis as more sort of an exposure to a toxic substance, it's sort of a poison. So it does seem to have lasting effects in the way that other substances may not, and I think that has to do with a more recent higher potency of THC. And I don't want this conversation to be sort of terrifying or scare tactics, because the reality is that a lot of people use cannabis all over the world and have for a long time, and it's not necessarily related to long-term mental health problems, and everybody uses it. In fact, it's not. But what I want to do is help us to develop the capacity to talk to young people about it in a way that's realistic and real, and to not just go along with the mythology that, well, it's a plant, so it's natural and it's good, and it's good for us. It helps our mental health, and there's really no downside, because that's just really not true. It's a much more complicated story than that. I think that people who use a small amount of cannabis and use it very sporadically or in a limited way, and who don't have strong family histories of severe mental illness, very likely can do that safely. But those aren't a lot of people that we're seeing, right? We're seeing, in our clinics or in our practices or in our programs, we're seeing higher risk kids, and we're seeing people who've been exposed to a lot of trauma. Speaking of trauma, people who've been exposed to a lot of adversity, and people who may have a lot of mental illness in their family, and people who have made a lot of histories of addiction in their family. And so I want to equip us to be able to talk more realistically about those situations, which are the ones that we're probably seeing most often in the places that we work.
And years ago, I heard somebody say, it was a father who was like, oh, this person, and he laid out all the names. And I said, you have no idea what that other child that your child is hanging out with has been through. And I had always heard that trauma is the leading factor of going into any type of addiction and using at heavy rate. And so therefore keeping that as an open mind too, of like walking in saying like, I understand you've been through some trauma because you're using every day, you're escaping something, obviously. I don't know what yet, but finding that way in as like giving them a break on themselves, because essentially like a lot of people who use substances already come out of it with such guilt and shame when they're trying to come out of it, like it's not fair too, or why can't I? So they're always beating themselves up of it's me, it's not my genetic makeup, and so practicing compassion with them too, of learning how to be nice to yourself.
Yeah, I think that compassion is so vital, and the assumption that people are doing the best they can with what they've got, and if they're using whatever they're using all the time, they're using it to cope. And so accepting that is sort of like, of course, that's where we're starting from. And I think, somebody put something in the chat, Bob Sepulveda put that, he works to help people identify their goals and strengths to achieve them. I mean, I think that's what it's about, and helping people understand like what role, everything in their life that they bring to you to learn about. What role is their sleep playing in achieving their goals? What role is their significant other playing in achieving their goals or not achieving their goals? What role is cannabis playing in achieving their goals or not achieving their goals? Treating it as something that you're just non-judgmentally going to examine and say, let's figure out together. It's like, is this help? Is this wind at your back, or is this wind in your face? As you're trying to get where you're trying to get.
I love with even I use tobacco use, any type of alcohol use, anything you spend money on, also to examine how much money you're throwing away to it. Totally. And then sometimes that's a good realization of like, oh my gosh, like it adds up, and so then like having that much money back in your pocket can be a motivational factor too sometimes.
Absolutely.
Rita has a question. When states decided to legalize cannabis use, what effort was made by the medical mental health establishment with influencing policymakers?
Yeah, that's a great question. It's tempting for me to get on my soapbox, but I'm going to try not to. That's not going to help anybody. I would say insufficient, Rita. I think there was a lot more known about the effects of heavy cannabis use on brain development. That's one of the things we should point out, Ariana, is like we're talking about young people too. We're talking about the most sensitive period of brain development in life, which is basically sort of 14 to 24 years old. And that's the time of development where brains were most susceptible to the stuff that we put in our bodies. And that susceptibility declines as people get older. So that's another factor here. And I think that science we've known for a while, and I don't know that it's been considered enough as these laws have changed. I think probably tax revenue has been a bigger consideration than the effect on young people, I'll have to say.
Agreed. And it's also providing them with that education too, of where it gets dispersed in their body, because a lot of people don't understand that it does affect your brain. And so showing them diagrams like, okay, whenever you inhale marijuana, this is all the places it goes, showing it the different aspects of what it does to the body gives them more information to make better informed decisions for themselves.
We have about 5 more minutes left for questions. Don't be shy. Don't miss the opportunity to join in on the conversation.
So in your experience, I guess I could ask this, how often is it that a young person is coming in and they're using minimal amounts of marijuana, very minimal?
That happens all the time. And if I'm seeing a 15-year-old or a 17-year-old and they're coming in because they've experienced a trauma or because they're suffering with depressive symptoms or they're struggling at school or whatever the case may be. And as I'm getting to know them, they say, yeah, I smoke a little weed, once a month or so at a party. And I tend to sort of leave that alone. And that's like that. I don't think that's just not that important. And if that starts to accelerate or if it comes up as a topic, we'll come back to it. But I don't think the goal is to extinguish any use of cannabis. It's to educate people and help them make decisions that are going to be helping them to get where they want to get. What about you? How do you handle that situation?
I look at it from their goal perspective, right? And so, yeah, if it's minimal usage, which sometimes you do see that quite frequently, then it's kind of like, okay, what I was always taught, what is the presenting problem? That's not a presenting problem, it's not causing huge concern in their life. Now, if eventually something's going on and then the usage starts to go up higher, then that might cause some problems in their life. But
Right.
Minimal usage is not something that I'm going to hound on you. It's like, I understand that you do it once every now and then, and because it stays in your system for 30 days, like you still have it.
Yeah.
But if you continue to report like, oh, my usage is going from 1 time a month to now you're at 4 times a month, I'm gonna be curious.
Yeah. Right. Agreed.
There's a question here. I think we have time for it. If you were a heavy user, let's say 20 years ago as an adolescent, will it still affect you today?
So go ahead.
I wasn't heavy usage in cannabis, but my addiction started at a very early age, and that's what led me to want to work with youth. Is I started using heavy substances at the age of 12 and on and off for 20 years. I continued to use substances. And I think in life, like in recovery, like it's going to affect you here and there, but it's making sure if it's related, for me, it was related to my mental health diagnosis. If it was related to that, then making sure I was under care of a psychiatrist, making sure I'm doing what I'm supposed to do to keep care of myself. But I mean, it can always be something that's out there. It just means giving those people or whomever you're speaking about the tools to not want to use today.
Yeah, I think that's beautiful advice and perspective, and sort of from a clinical perspective, just in response to this question too. So the evidence is that if people who are very heavy cannabis users, if they stop using before the sort of late 20s to early 30s, the long-term effects tend to diminish with time. If people who continue to use into their 30s, there tend to be longer term effects on things like memory and cognitive ability. There is a, that's another thing I talk to kids about a lot, who value their minds, kids who value their intellect and their thinking ability. That if you use throughout, starting in adolescence throughout your adulthood, it does have a cumulative effect on cognition. But people who stop or who reduce significantly that effect really diminishes and goes away with time.
Awesome. Well, I want to say a big thank you to Matt and Ariana. This has been just an incredible session. I learned so much in it. And I want to remind folks that you will receive a recording of today's session. Also, we will not have a PACT session next month because we are having the System of Care Summit. That is a no-cost summit. It's a 3-day event. It's virtual. We'll have over 60 presenters. There are already 1,600 people from across the nation registered. So I hope you're one of that 1,600. If not, the link is in the chat where you can register for the no-cost summit. We'll join back together in June to talk about positive outcomes from engaging families, where again, we'll have a clinician and a peer joining that discussion. I've already told you about the summit. When we close down this session, there's a post survey that will appear. Please participate in that post survey so we're always bringing you content and information that you need to be successful. Thanks again for joining in, and I hope that you have a great rest of your day. Take care, everyone.